April 26, 1994. Little did I know at the time that what started out like any other ordinary day would bring a pivotal change in the course of my life. I had a follow-up appointment with an allergist in Boston. I had seen him a few months earlier because my allergy symptoms were getting worse, and I noticed they were particularly bad following a shift working as a registered nurse at Brigham and Women's Hospital. At my first appointment, the doctor did some breathing tests and blood work that didn't show anything very specific, so I really didn't expect much to change at this appointment. When I came in for my appointment, the allergist asked me if I had had any new reactions since they'd seen him last, and I told him about a couple of times. Once when I was at my nephew's birthday party, and another time when my mother gave the kids those big blow-up punching balls, and they were punching them in the same room where I was, and suddenly my voice got hoarse, my chest got tight, and I was having trouble breathing. When the allergist reviewed my breathing test and these new symptoms, he told me, even though your blood work came back negative, I think you have a very high level sensitivity to latex, and you have to be very careful to avoid any exposure at all. Well, I'm working 3 to 11 tomorrow, so I'll just stop and buy some vinyl gloves on my way into work. No. Because of the exposure to latex in the air, you can no longer work in any type of a clinical setting. You can no longer work as a hospital nurse.
It's very, very devastating. I didn't see it coming at all. It was part of my identity. If I'm not a nurse, then who am I?
He looked at these challenges as something he could overcome.
Well, I met Gordon through my friend Mary. We were both working at Brigham and Women's Hospital at the time, and Mary had started taking care of Gordon about a year or so before, and he was moving from his own home back into his house with his parents, and he knew his parents couldn't do a lot of his care, so he needed to have more nurses to help him get up in the morning and to put him to bed at night. When Gordon found out I had the latex allergy, he got rid of all the latex in his house. He started using like vinyl gloves and then some nitrile gloves so that there was no latex around, so I could continue working with him.
When Gordon was 6 years old, he was diagnosed with muscular dystrophy. By the time he was in middle school, he was wheelchair bound. In his senior year at Tufts University, he developed pneumonia, had to be trached, and put on a ventilator.
It is the most common childhood form of muscular dystrophy. It affects boys almost exclusively, and those who have the disease often don't live past their 20s. Gordon Sterling of Norfolk is one man who has defied those odds.
Physically, Gordon was very, very weak. Yet undoubtedly, he is the strongest person I will ever know.
One of the best things about my career is that I was born at exactly the right time. Technology has advanced at the same rate my disability has. So as I've become more disabled over time, technology has helped to compensate.
He needed to make the decision that he could no longer eat or drink anything by mouth. His swallowing muscles had become so weak that he was, choking, and even just trying to take a drink, he would like gag on it, and tears would be pouring down his eyes.
Gordon wasn't angry. He didn't see himself as a victim of his disease. He loved his life.
He would say, it's not a flaw, it's a feature.
By watching Gordon live his life in such a positive, content way, I learned to focus on what I could control, to commit to rebuilding my professional life. I am so lucky that he was there for me to put the wind back in my sail and help set me on my new course.
My hope is that those stories continue to have that positive ripple effect, as I've seen that his life had on me and all the people that I know personally.